Hi, my name is Dr. Bobby Sura. I'm a consultant clinical psychologist, systemic psychotherapist, director at Solihull Wellbeing Clinic. This evening, we're going to be having a live stream video interview with Jill Williams. Jill Williams is a Bowen Technique Therapist, fully accredited, and she's with me today. So without further ado, I'm going to invite Jill into this stream and we can talk about the Bowen technique. So Jill,
Hi.
hi, welcome. How are you?
Yeah, I'm really good. How are you?
I'm great, thank you.
Good.
Lovely to have you here, Jill. I'm
Thank you.
very, very honoured that you've accepted this invitation and you're here to talk a little bit about yourself and what you do. These Wellbeing Conversations show, we run them every so often, and it's just a way of sharing a little bit of wisdom, a bit of knowledge about what's out there to help people. And I know that the Bowen technique is something that I've heard about over the years, but nobody's really explained it to me. And I'm sure there's lots of people, lots of people like me
Yeah.
out there. So we can talk about it. But before we do, Jill, tell me a little bit about yourself. How did you get into the well-being space and the holistic complementary therapy space? Do you want to say a bit about that?
Yes, I'd love to. Thank you. I was a general manager in hotels for 25 years, in hotels for 40 years.
Yes.
And we went through COVID, as everybody did, and it was very challenging. And I came out of I think it was the first or second lockdown, and I'd had Bowen myself for about 10 years.
Mm-hmm.
And I went to have a Bowen treatment because I needed help after coming out of lockdown. And I was lying there while I was having the Bowen, and I thought, I wonder if I could do this.
Mm-hmm.
Very different to what I have done previously. I mean, you couldn't put hotels and Bowen together, really.
Mm-hmm.
So I spoke to Martin, who was my Bowen therapist, and said, is this possible? And he said, absolutely. And then I started a journey of discovery.
Mm-hmm.
and working out, could I do it? Where could I do it? Where could I be trained? How was that possible, really?
Yeah.
And so my mum played golf up until she was 80.
Mm-hmm.
And she'd hurt her back when she was 76.
Right.
Lady captain at the golf club, and she hurt her back, and I said to her, you need Bowen. So
Right.
I arranged for her where she lived, which was in Shropshire.
Uh-huh.
I arranged for her to have some Bowen treatment.
Mm-hmm.
And she couldn't believe it. After 6 sessions, she was playing golf again.
Wow. Okay. That's something that,
Yeah, so absolutely incredible. And I've had it, as I say, for 10 years. So I just thought I wanted to do something that I could give back. I felt as if I had that need.
Yes.
You know what I mean?
Yeah.
And because I really rated Bowen, I thought that was a great opportunity to train. And but as you say, a lot of people, it is still an unknown therapy, really.
Yes. So origins in Australia, I understand, Jill. Is that right?
Yes, that's right. Geelong in Australia. Tom Bowen. In fact, it's his anniversary, birthday this year.
Right. Okay.
This week, in fact.
This is very timely.
Yes, yeah, exactly. Who knew? And I understand he was seeing 30 to 40 people a day.
Wow. Okay.
They were queuing out of his home.
Uh-huh.
And he'd do a couple of moves, and quite a different, I think, therapy then, because it was his. It wasn't anybody else's, and nobody else had trained at the time.
Right.
So then people had heard about it, and then they went over to see him, and people started to write down what he was doing. And that's then how it came over to the UK about 30 years ago.
Fantastic. So yeah, I mean, he started, I think, in the early 1900s. I was reading, and passed away about the early 80s, something like that. 1980.
Yes.
So it's gone on for what's that, 50, almost 50 years now.
Yes.
So it's obviously got some longevity, hasn't it? It's carried on beyond him.
Yes, and in Australia, I would say that it's more of a household known therapy. And certainly the person that, Martin, who I had Bowen with, Martin Graspy,
Yeah.
He's been doing it for over 20 years. The college that I trained with, the Bowen College, Julian Baker, he trained in it. He went to Australia and met him. And so he's been trained for 30 years. So it is relatively unknown, which is a shame because it's so incredible. So I'm banging that drum.
Well, this is a great place to do it, Jill.
Yes.
So let's talk a little bit about it then. So it's a hands-on therapy, isn't it? So how does it differ to massage, deep tissue, that kind of thing? Is there any equivalence, or is it totally separate and different?
Totally separate and different. With the hands, you basically use your forefinger and thumb, and it's a rolling move over the fascia over the skin, and then it has a neurological response to the brain. To let go of the pain that's there. And I think, I mean, everything has its place, isn't it? And I'm a big believer, if somebody wants to have a sports massage and have somebody's elbow put into their, neck area, their back, whatever, glute, then, and that works for them, that's great. But a lot of people don't like that.
Yes, it can be, can't it?
Yes, and this is a non-invasive, very, very gentle, and I think sometimes people don't quite trust it because it's so gentle, but it's, I'm seeing some patients at the moment and the changes are remarkable.
So do you need to have an injury, an illness, a condition to have Bowen? I mean, when would somebody think about approaching someone like you, Jill, for Bowen therapy?
I mean, I think quite often Bowen is used for pain management. So if you do have an issue, an old injury, or you've hurt a specific area of your body, then it can absolutely help. But I think what's surprising is that it can help things like menopause, stress, because it puts the body into rest and digest.
Right. So into that state.
Yes.
Of rest and digest. Okay.
Yes. So it allows the body to take a moment and to really switch off. And I always say, when people get off the couch, they have a Bowen face.
Okay.
And that is just completely relaxed. And quite often people can't speak after it because they, if they've come in and they're sort of really stressed and anxious, after they've had Bowen, you can see a complete change in somebody's physical appearance.
So they're relaxed or sort of like is there a glow? What is the Bowen face then?
It's just completely relaxed. Sometimes people, as you can see people's faces, can't you? And the people, they tell you how they are by the look on their face and their stress levels. So migraines can be helped. Basic headaches, things like fibromyalgia. I mean, that's very complicated. It's a very complicated condition. Again, I'm seeing a lady who has fibromyalgia, and it really allows the body to stop. And and when you sleep, Bowen, you know,
Mm.
during sleep is when the magic happens.
Okay, so it carries on having a
Yes.
positive impact
It can take days, it can take weeks.
over several days. Yeah.
Yes.
So
Yeah.
these are pretty sometimes chronic conditions, aren't they? And
Yeah.
very debilitating. Fibromyalgia,
Yes.
migraines. People suffer with them all their lives.
Yes.
So, do you feel that, in your experience, Jill, these are curative, or do they help manage these pain symptoms? What's been your feedback from your clients, would you say?
Yeah, I mean, I would never sit here and say it's going to cure, because that that
Yeah,
would
that would be
not
a claim. Yeah,
be a good idea.
yeah,
It certainly helps people manage.
yeah.
It helps people manage, pain. It helps people manage. I know when I've had Bowen,
Hmm.
it can my energy levels can change.
Right.
When I went to see Martin after the COVID,
Hmm.
and it was the first or second lockdown.
Hmm.
I'd had Bowen. I was euphoric for a week. I mean, I
Right.
came out and I could have taken on the whole world.
Right. So,
And
it
that's
really
what,
boosts your energy levels and your
yes,
sort of
yes,
positive
yeah,
mindset, positive mind, body, spirit kind of feeling.
yes,
Really, it's fantastic.
yes,
So yes, I think you're right, because if you think about the medicinal, and sort of allopathic and other sort of invasive treatments, if you like, or putting things into our body, equally they only manage symptoms, don't they? And this is
yes,
another way of doing it without putting chemicals into your body, and without, I suppose, it's using the body's own
yes,
chemical, neurochemical systems, I would imagine.
yes.
Is that the kind of basis of it, perhaps?
Yes,
Yeah. Mhm.
and as I say, with that move over the fascia area,
Yes,
is literally sending a message, a neurological message to the brain.
the brain.
And I mean, quite people are holding on to pain.
Hmm. Hmm.
So some people come to me and they've no idea how they've got that pain,
Yes.
but they haven't hurt themselves, they
Yeah.
haven't fallen over, they haven't got a sports injury, but they have a pain.
Hmm. Hmm.
And it's about allowing the body to release that pain.
Yeah. Okay. It's fantastic. So, what about things like sciatica? This is another common problem,
Yes,
isn't it? That people
yes,
go to kind of chiropractors, osteopaths about.
yes,
That, I mean, I've suffered with sciatica myself. I lifted a box and twisted at the same time. I was
yes,
out off work for a bit, and my foot was very flat, and I couldn't feel the ground and stuff. So driving was difficult.
yeah,
Would people with sciatica come to you?
yeah. I've got
Yeah.
a lady at the moment who
Hmm.
has sciatica, and when she came to me last week, she really was in a lot of pain.
Right.
And when I sat down, it was today actually, when I sat down with her today,
Uh-huh.
and because we asked people out of 10,
Mm.
what's the pain, so that you can see each week if it changes, because
Mm.
it's about changing. It's not about miraculously somebody getting better. It's
Mhm.
about changing.
Mm.
So if somebody's 10 out of 10 through pain, and
Yeah.
then week they're an 8, then that's a nice change.
Yeah. So the pain threshold or the pain sensation
Yes,
reduces, and pain does have a very subjective aspect, doesn't it? Sometimes
yes,
it can override pain, and I remember through my psychology training, there's a sort of gateway theory of pain, and
yes,
so these holistic and alternative interventions, sometimes they can tap into things that conventional treatments can't,
yes,
um, and I think people need to take time to understand, these things. So, for example, things like yoga,
hmm,
they have a multitude of health benefits, uh,
yes,
but I think because huge companies that are making lots of money through drugs and medicines, they don't fund research into
no,
these other
no,
therapies. We never really get to hear about it, but personal
exactly,
testimony has a lot to bear, doesn't it? It tells people
yes,
that this is working. Okay, so in terms of other questions, then, when you come to a therapy session, what should somebody expect? So they're going to have to be unclothed. lie down on a couch? Is that kind of the process?
Yeah, so I mean,
Mm.
some people that practice Bowen ask people to go down to their underwear,
Mm.
and because they like to work on the skin.
Yes.
I personally ask people to wear light clothing,
Okay.
light sort of jogging bottoms and a t-shirt,
Okay.
comfortable, so that I can feel the skin, but I don't necessarily need to touch the skin.
Okay. Okay.
And yes, it's on a couch, so I've got a couch, and the slightly different thing I think with Bowen is that, and people have to get used to, is that you do a certain amount of moves,
Yeah.
and then you let the body rest. You let the body accept the moves that you've done, and you literally you leave the person in the room
Okay.
for sort of 2 to 3 minutes.
Wow. Okay.
And the body is then accepting,
Yeah.
working out what's happening.
Okay. So
And that's quite unusual.
what do people tell you about that experience then when when you leave the room? Do they ever talk to you about what that felt like?
Yeah, I've asked different people. I mean, I suppose I'm used to it because I've
Uh-huh.
had the treatment for 10 years, but
Uh-huh.
in the beginning they do think it's odd.
Yeah.
But once you explain the
Yes.
reason why, and they then accept. But I think because they go so relaxed, most people nod off.
Uh-huh.
So they're quite
Right.
happy.
That's what I was thinking, that actually it might make people super relaxed,
Yes.
because you're actually when does that ever happen, that
Yes.
you're left in this kind of relaxed state for a period of time?
Yes.
And maybe
Yes.
those pauses are actually really really helpful.
Well, it is part of the treatment for sure, because it was funny because I was talking to somebody not so long ago, and they said, "Oh yeah, no, I tried Bowen, but what's this? Leaving me alone in the room for however long." She said, "Not for me. Doesn't work for me. I didn't like that." And I said,
Right.
"And that's
Right.
fine.
Yeah.
Whatever." I'm a big believer. There's lots of techniques out there, and if it's not for you, then it's not for you.
Yeah. So, I mean, I suppose you could, in that sort of situation, potentially just step away and still be in the room, or would
Yeah.
that would be fidelity to the Bowen model, maybe?
Yeah, no. I mean, one lady said to me, I don't actually want you to leave the room.
Okay.
I would like you to stay." So I did.
So you stayed there, yeah. So there
Yeah.
are ways in which you can sort
Yes.
of accommodate different needs,
Yes.
and
Yeah.
yeah, yeah. And I suppose the fact that people are, uh, you know, clothed in light clothing, a lot of
Yes.
people will prefer that as well, because
Yes.
not
Yeah.
everybody's sort of comfortable or used to that, are they?
Yes.
And
Exactly.
if it has a similar effect, then that's fine, isn't it? You're working on it. So, with the sorts of conditions we've talked about, fibromyalgia, sciatica, I'm assuming, migraines we talked about, aches, pains, that kind of
Mm.
thing. Physical injuries as well. Would it be of any use to somebody that's had a kind of, sprain their ankle, or
Yes.
had a football injury or something? Does it
Yes.
heal in some ways those sorts of issues too?
Yeah. Well, again, it relaxes that area. So
Okay.
basically there are certain moves that you do, and
Yeah.
then you can add in different movements as well. So, but yes, it's because it's so gentle and
Yeah.
there is no manipulation.
Yeah.
It's very useful for people that have had
Uh-huh.
specific injuries. So yeah, I mean,
Okay.
I haven't personally, but I know that like
Mhm.
rugby players that have had massive injuries, it's been very useful for that.
Mm, mm.
Because of course it's not, the body, because it's so gentle, the body doesn't go, it doesn't sort of tense up, because I
Yeah.
think some treatments, the body will naturally tense up because of what's happening to them.
Yeah, I know, I appreciate that. So if people are choosing different sorts of options, people look at things like acupuncture, acupressure, Thai massage, Chinese massage, whatever it might be. And then, of course, you've got, Reiki, and you've got sort of other holistic therapies, cupping and various
Yes.
things, as well as then alongside, I mean, that's just a short list of things, aren't there, in terms of
Yes.
complement holistic field. And then you've got things like physio and chiropractic and osteopathy and conventional medicine. What would lean somebody towards the Bowen technique? Why might they choose Bowen over some of these, or would you actually recommend that it could be combined with these other things?
We suggest that it's not combined. We suggest that if you're having Bowen, that you stay with Bowen for as long as you have Bowen, and don't have anything else, because because otherwise you don't know what's working.
That's true.
And it confuses the body.
Yeah. And sometimes you can be overstimulated. I mean, I remember going just for a massage, and I had a body massage, and I asked for a Indian head massage, and they said, look, it's going to be too much for you, even though they would have made more money out of it.
Yes.
I just sort of listened to their expertise, because you can sometimes overdo it. And how many sessions would you be looking at, Jill? So if people have a sense of, is it something they need to keep doing for months and months, or how does it work, and what are the gaps between appointments and so on?
So initially, it's usually suggested that you would have 3 treatments.
3.
One a week for 3 weeks.
Okay.
And
it's
then
fairly short. Yeah.
Yes, and then it depends what you're dealing with. A lady I'm dealing with at the moment, she has got quite a lot to deal with. Got sciatica, and she's had the 3 sessions. She said, I need another 3. I feel as if there are changes, but I would, I want to keep going. So she will have another 3, whereas another lady had the 3, and then she said, I would like to now have 3 sessions, but fortnightly.
Right.
And so it's quite prescriptive to what people require. But it's, I think after 3 treatments, if it's suiting you.
Okay.
You'll start to feel changes. That word again. And after that amount of time, I think if you feel something is happening for you, but definitely have it on its own. And I would say anything that you had, chiropractic work or acupuncture or anything, have it on its own, so that you know if it's working or not.
Give it a clear space, and each session is how long? So if somebody comes for a session, how long would one session last? Is that variable?
So the first one is always a bit longer, because obviously you're taking case history and you're understanding, what people are dealing with. So that could take, up to 50 minutes, because you've got an awful lot more to talk about. It could be an hour. It depends how much. And then after that, it's usually between 40 and 45 minutes. And it's really based on what the body needs, rather than anything else. And when you're seeing somebody, and somebody's standing in front of you, and they're sitting down and they're explaining how it's affecting them, because it's really how whatever they have is affecting them on a daily basis. You want to try and see changes each week, so that there's things are changing for the better.
Right. Okay. So it's fairly short sort of session time, and three sessions is the kind of standard model, and maybe some people have top-ups on top of that.
Yes, and then maintenance after that. So again, some people would come every 6 weeks. Some people might come every month. Again, it really is dependent on what people feel. Once people have Bowen and they feel changes, they really enjoy that. So
Yes.
therefore they don't want to lose it.
That's lovely.
Feeling.
So this is great. Do you do other things as well as the Bowen technique? Do you have
well, I've recently done my Reiki too. So so that's been very interesting. I now have very warm hands when I do Bowen because of that. So that's been fascinating. So I haven't started treatments yet, but that's something I will be doing. And I'm also looking at NLP and coaching because I feel as if I'm now on that journey of helping.
You're growing, not being able to offer a holistic package of support.
Yes.
So Jill, if somebody wanted to have Bowen therapy with you, how would they get in touch with you? I know that
So I'm on social media. So I'm on Facebook and Instagram.
Yeah.
It's the Solihull Bowen Technique.
Yeah.
And my website is www.solihull.
Yeah.
I've forgotten the word.
I'm bringing up your logo here. So Solihull Bowen Technique.
Yes. So hyphen-technique.com.
Say it again because I interrupted you.
It's www.solihull-bowen-technique.com.
Fantastic. So, and you can find, I suppose, if you Google Solihull Bowen Technique, that's another way to get through to you. That's fine.
I've got a Google account, and my website is on there. And I post regularly onto Instagram and to Facebook. And I have to say, a lot of my business comes from both of those areas.
Well, lovely. Thank you very much, Jill. That's been very informative. It's been a short session, but just to whet people's appetite and help them think a little bit about Bowen, and people that have heard about it but perhaps haven't had time to read about it or look into it. At least they know a bit more, and hopefully it will generate a little bit more work for you, and also help people that haven't accessed this sort of approach before to get in touch and get some help, because these painful conditions can be very debilitating, and sometimes people get I don't want to sort of put down standard NHS or GP general practice care, but people get a bit tired of the ibuprofen and the paracetamol.
Absolutely, because that's what they're given, as you say. That's
it. So it's nice to have alternatives, and maybe one day people can access all of these things through their GP practice. I mean,
wouldn't that be great? Wouldn't that be absolutely incredible?
In fact, I read somewhere that you can get a budget devolved to you, a patient budget or something it's called. I've never heard of it before, but you can go to the GP and ask for the budget that they get per patient to be allocated to you to spend how you would like. I don't know how easy that is to do, but it's a conversation, I suppose, to have with your GP. I don't know what that means, if you needed other treatments or other assessments. So maybe that would have a negative bearing on that. But thank you very much, Jill. I'm going to let you go, and it's been lovely to spend some time with you.
Thank you.
You're welcome. So that was Jill Williams. She is a accredited Bowen therapist. In terms of other things that I want to say before we finish today, obviously we've been talking about Bowen with Jill today. This video will be available for everybody even after this session, this live stream ends. So you're very welcome to share the link with other people, tell people about what we do here, tell them a bit about the clinic as well. So we are Solihull Wellbeing Clinic. We are based in Hall Green, and I know that sort of stumps people sometimes. Why have we called ourselves Solihull Wellbeing Clinic when we're in Hall Green, Birmingham? Well, we're on the edge of Solihull, and our clinic, our practice began in Solihull, and we changed premises, but we retained our name. So that's the reason for that. But those are some of our contact details. You're very welcome to get in touch. We do a lot of different stuff, so this is our newsletter, which can be sent out to you if you'd like to just subscribe. That always has some good well-being articles. And if you go onto our website, we've got a whole bunch of different kinds of practitioner, from counselors, hypnotherapists, psychiatry, psychology, counseling, psychotherapy, all of that. And you can come and have a look. Coaches, neurofeedback. There's a lot going on here that you're very welcome to come and find out about. And we've got a lovely premises. That's our little reception area. That's our clinic front on the Highfield Road. And of course, a wonderful website that's got lots of resources, articles. And as you can see on the left here, links to social media channels where you can find lots of back videos, streams that we've done and specifically designed well-being videos. And I've got quite a bit of psychological wisdom on there that I've gained over the years, and techniques and free resources really to help people manage their stress, manage their mood, reduce their anxiety, and so on. So I'm very, very thankful for you for tuning in. I thank you very much. And we're going to be having more of these live streams over the coming weeks. So thank you all. It's been Solihull Wellbeing Clinic. Bye-bye now.